Hi there, Dr. Luke here, and what we're going to do today is go through some capsular knee CARs. And this is going to help us to be better with our knee CARs, our controlled articular rotations. I want to do a few variations here. This is something that is going to be difficult for those that have abnormal function through their knee or degenerative changes through their knee. So we need to work on this one every day consistently to open up that joint capsule and get this movement back. The movement that we're after is our internal external rotation. So for this white setup, we want to bring your arm underneath the knee, hand on the thigh. We don't want any compensations through the hip. We just want to see the internal external rotation of our tibia. You'll observe that as you're doing that movement. So, and we want to dorsiflex the ankle so we can lock that ankle out, and then we externally rotate and internally rotate. Externally rotate, internally rotate. Observing that movement of our tibia there. We can also feel for that movement as we feel the back of the knee in with our hamstring attachments there. And making sure that you're getting good movement just through that tibia and not through the hip. If you're finding it difficult to get that movement, let's engage those hip joints by squeezing a yoga block, dorsiflexing the ankles, hugging the thighs here, and what we want to do is internally rotate, externally rotate, internally rotate, externally rotate. Really focus on that tibial movement there. Very good. Another way we can do this is use a wall, pressing up against that with our knee. So we're engaging that hip, dorsiflexing the ankle, and again, we're externally rotating and internally rotating. Fantastic. We can also do this movement in a slight extended position. Internally rotate, externally rotate, internally rotate, externally rotate. We can also do this in a flex position. I use a little bit of a foam block here to protect the knee. Use my balance sticks. Bring my knee into flexion, dorsiflexing the ankle, and then we internally rotate and externally rotate. Making sure that we're getting that movement from the tibia. It's really difficult, this one, because you're not observing that movement. And we can also lower the knee down into more extension and do that movement from this position here. So really just trying to work on that joint capsule and that internal external rotation. Fantastic. The other way that we can do that, if you have wooden floors or floors that are a little bit smooth, you can use our weight there. I've got a 2 kilogram weight. I bring my knee up into that 90 degrees, hip in 90 degrees as well. And what we want to do is we want to then externally rotate and internally rotate. And this is really good because we have to really focus that movement and really stabilize our knee with this one, and hip, to make sure that we're getting the movement through the tibia there. So really making sure that you're breathing in and irradiating, that we're switching on our core to focus that movement in internal external rotation. So give these a go. Certainly vary the exercises that you do here in different positions to stimulate different areas of that joint capsule, and this will really help to start getting function and movement and health back to your knee again. So keep it up and give those a go.